I'm Dr. Frita, and today I'm giving you the top 5 symptoms and warning signs of multiple sclerosis everyone should know. Multiple sclerosis, or MS, is an autoimmune disease where your body's immune system attacks the protective covering over your nerves, or the myelin. So your antibodies incorrectly attack your central nervous system, meaning your brain, your spinal cord, and even your optic nerves, or the nerves that supply your eyes, so you can see well. When I talk about this protective covering for the nerves or the myelin, I want you to think of it like the protective covering over an electrical wire. And when you have defects in this protective covering, you have a misfiring of signals from your brain to the rest of your body. When your body's immune system attacks this myelin sheath, the myelin sheath does try to heal itself, okay? And so then you get scars on the different parts of this protective sheath, the myelin sheath, as it tries to heal. In multiple sclerosis, you get many scars, multiple scars, or multiple sclerosis, which is where the name comes from. According to the National Multiple Sclerosis Society, about 1 million Americans are affected by multiple sclerosis, and most are diagnosed between the ages of 20 and 50. And people with MS have very different experiences with the disorder, and that's why they call it the snowflake disease. Just like no two snowflakes are alike, no two people have the same experience with multiple sclerosis. There are different types of multiple sclerosis. Relapsing remitting is the most common type. It accounts for 85% of the cases. There's also secondary progressive, primary progressive. Today, I'm going to walk you through 5 common signs and symptoms of multiple sclerosis. This is not about diagnosing yourself. It's about being better informed so that you can have a more effective conversation with your doctor. So let's get started. Here are the top 5 symptoms and warning signs of multiple sclerosis everybody should know. Keep watching. Please go ahead and give this video a like and subscribe to the channel if you haven't done so already, because I'm about to give you some evidence-based medical information. Number 1, vision changes and optic neuritis. Interestingly, vision changes are often the first warning sign if you have multiple sclerosis. So it's very important to pick it up. And these vision changes aren't as simple as, I think I need a new pair of glasses. No, they're pretty distinct. You might develop blurry vision, or the colors in the world might all of a sudden seem like they're washed out. You might even get pain in your eyes or develop a dark spot. So we're talking about optic neuritis, which is the inflammation of the optic nerve. And your optic nerve connects your brain to your eyes. So if you think of it like this, think of the optic nerve being like a cable. In your home, if the cable that attaches your camera to your television becomes damaged or inflamed, that would mess up what you see on the TV, right? It would give you a horrible visual. Well, same thing. When your optic nerve is attacked by your immune system, that distorts the way that your vision appears. Plus, there may be other neurological symptoms. Now, here's the key in picking up these vision changes or optic neuritis. The symptoms are not usually gradual. They can happen pretty quickly over a matter of days. And oftentimes it will be one eye. Certainly it can be both, but you might get symptoms in one eye, like pain in that one eye, or when you try to move that eye, it hurts, or the vision being blurrier in an eye. You definitely do not want to dismiss these symptoms. So when do you see a doctor about these vision changes? If you have sudden vision change, especially if it's in one eye, and if these changes develop over a matter of days, also if you have pain with eye movement, and if these vision changes are accompanied by other neurological symptoms. Question: have you ever had a symptom your doctor could not explain? How did you advocate for yourself? Please comment down below. Number 2, numbness and tingling sensations. Now, everyone has had a foot that has fallen asleep when you sit on it for too long or when your position is off, but this is different when we're talking about a warning symptom of MS. So with MS, you can get numbness and tingling. You can get burning or a vibration type of a sensation. You can even get feelings like an electric shock. What happens is, due to that damage of the myelin sheath, the nerve signals that your central nervous system normally sends to your body as far as touch and sensation and pain, they get all scrambled up. And so you end up with the numbness, the tingling, the burning, and the like. So how do you tell the difference between just run-of-the-mill foot falling asleep versus what could be a warning sign of MS? Well, in multiple sclerosis, instead of you getting this kind of numbness and tingling, this pins and needles, and then, it goes away after a few minutes once you stand up or change position. With the multiple sclerosis, this sensation is going to be persistent. It can last for days or even weeks. Also, it's not positional when it comes to MS. The numbness and the tingling and the pins and needles will not get better once you stop sitting on your foot or once you stop, sleeping on your arm the wrong way. It's not going to get better with different position. Also, with MS, you can get like an electric shock sensation occasionally. With MS, this numbness and tingling sensation will typically affect your hands, your feet, your limbs. It can also affect your face. So when do you see a doctor? Well, if this numbness and tingling sensation persists for more than 24 hours, also if you notice that it's one-sided and that you're getting electric shock with it, and very importantly, if this numbness and tingling sensation starts to interfere with your activities of daily living. I really enjoy sharing medical information through videos like this, but I found over the years from comments that a lot of times people have more questions. That's why I now provide a telehealth concierge service where I can talk with you one-on-one. Yes, you can book an appointment and we can have a conversation from anywhere in the world. You can get a second opinion from me, a first opinion. I am an MD who has been quadruple board certified, and so I definitely have a lot of medical knowledge to share. If having a one-on-one conversation with me sounds like something that might enhance your health information, please click the link in the description or go to my one-stop shop, dr.frita.com. Number 3, extreme fatigue that won't go away. Now, I know that sounds pretty non-specific because everybody gets tired sometimes, but with MS, we're not talking about run-of-the-mill being a little tired because you didn't get enough sleep. We're talking about a debilitating, unrelenting fatigue that is exhausting, really regardless of how much sleep you get. Simple tasks like taking a shower can lay you out and exhaust you if you have multiple sclerosis. And here's why. That damage to the myelin sheath causes your body to work a lot harder to send simple messages to your body. Another thing is that with MS, the heat will oftentimes make that fatigue worse. The fatigue is called lassitude. If you have MS and you are experiencing this extreme fatigue, please don't let other people downplay it or tell you, oh, just motivate yourself. Don't let them tell you it's in your head. It is a real physical symptom. So here's how to tell the difference between run-of-the-mill fatigue versus fatigue associated with multiple sclerosis. With MS, the fatigue is disproportionate to the activity that you've been involved in. Also, the fatigue does not get better with rest. Another thing with MS is that the fatigue can be sudden. You can be up, ready to go, have made plans with friends, and then all of a sudden, you're zonked, you're wiped out. Also, with MS, this fatigue often gets much worse in the heat. So when do you see a doctor about this fatigue? Well, when you have exhaustion that does not get better with rest, when the fatigue is interfering with work or with your daily life, when you notice that you're getting sudden energy crashes, and certainly if the fatigue does get worse with heat. Question: what's your biggest challenge when explaining your symptoms to doctors? Please share in the comments. Number 4, balance and coordination issues. Now, a lot of people, might feel a little clumsy sometimes or be accident prone, but it's pretty distinct when it comes to MS. With multiple sclerosis, you might develop a dizziness or like a vertigo. You might have difficulty with how you walk. You might notice that you're tripping and falling. And here's what happens. With MS, the lesions on the brain and the spinal cord can affect the centers of your central nervous system that help you with balance and coordination. And so you might find yourself having to hold on to walls to keep from falling when you walk. You might find yourself having a foot drop or dragging your foot or walking in an unsteady manner, not really knowing when you're going to trip and fall. And so it becomes a safety issue. So how do you know the difference between balance and coordination problems from MS versus just run-of-the-mill clumsiness? Well, if you notice that it is a sudden increase in your clumsiness, or if you're having difficulty with tasks that were easy for you before. Also, if you have a persistent dizziness, and certainly if you have a foot drop or a difficulty in your gait or the way that you walk. Here's when to see a doctor. If you're noticing frequent falls, persistent dizziness, difficulty with fine motor skills like holding a pen or threading a needle. And also, if your balance problems are interfering with your daily life. Number 5, cognitive changes and brain fog. Now, this is a very tricky one because it's an invisible symptom. Like if you have MS and it's happening to you, no one really knows what's going on in your brain, but you know it. You have cognitive issues and brain fog or cog fog. So you might have difficulty with word finding. Okay, you're thinking about the word, it's on the tip of your tongue, but you can't find the word. Or you might have trouble following conversations, or you might walk into a room and forget why you're there, okay? If this is happening to you, you are not going bananas. You're not losing your mind. It's actually a very real symptom of multiple sclerosis. What's happening is that your brain's processing speed is being slowed down, almost like a computer that's running with too many programs that are open, and so it just slows down. That damage to the myelin sheath is causing your brain to process at a slower speed, and so this is what's giving you that brain fog, those cognitive issues. And I'll tell you what can make this cog fog worse. If you're stressed out, if you're fatigued, and also being in the heat can make this cognitive change worse. How can you tell if your brain fog might be related to MS? Well, if you're having difficulty with tasks that were previously easy, if you're noticing that you're having slower brain processing speeds, and certainly if the brain fog is worse with heat or with fatigue. When to see a doctor? If your memory changes are interfering with work or your daily life, if you notice that your cognitive changes are getting progressively worse. Also, if your cognitive or memory issues are associated with other neurological signs and symptoms. There are treatments for multiple sclerosis. No, we don't have an absolute definitive cure, but MS now is not the same as it was 20 years ago or even 10 years ago. We have over 12 FDA-approved drugs. We have infusions. We have more information and research about lifestyle modifications that can help. Stop smoking, exercise. Certainly a healthy diet can help. Physical therapy, occupational therapy. No, things aren't perfect, but there are ways that you can have a full and active life. My patients have it, and most do quite well with treatments. I have family members with multiple sclerosis who have had a world of improvement with treatments. The key is to recognize symptoms and to act early. Pay attention to your body. If you're having the warning signs and symptoms that we covered today, like vision changes, numbness and tingling sensations, extreme fatigue, balance and coordination problems, and certainly if you're having the cognitive issues, the cog fog, don't dismiss it. Go see your doctor and be your own advocate. If you found the information in this video to be helpful and informative, please be sure to give it a like and share it with the people you care about. Multiple sclerosis is real, and it's probably more common than people think. And so I really want you to be aware of the warning signs and symptoms so that you can be proactive. As always, I appreciate your support, and I want you to do your best to live your healthiest, happiest life. I'm Dr. Frita.